We would like to acknowledge the Yagara people and the Turrbal people as the traditional custodians of Mianjin, the lands in which we record this podcast today. We pay our respects to elders past, present and emerging.
Always was, always will be Aboriginal land.
Hey everybody, welcome to For the Health of It podcast, a Healthcare Australia podcast.
Made for healthcare professionals by nurses on the inside. My name is Jessica.
And I'm Zana, and we are doing a podcast today all about Breast Cancer Awareness Month. So it is October, which is Breast Cancer Awareness Month around the world, and we wanted to speak about this journey that people often have with breast cancer and the frequency and the statistics and the awareness around it. So we actually are being joined by an amazing guest later called Ruth, who herself has the BRCA1 gene. She's in her late 20s and found out about this when she was 19. So this has been a serious journey for her and a kind of a progression in her life of how this has looked and what her future is going to look like as well. So we wanted to touch on her story and what she brings to the table with this discussion, but we just wanted to start with a little bit of statistics around breast cancer as well. For those of you who don't know, we're also sending out support for anyone who has had breast cancer or supported anyone with breast cancer as well. We are with you and we want to, create awareness and education so that we can prevent as many breast cancer cases as possible, because
Absolutely.
We want to eliminate this altogether because it's not nice. We all know someone who's been through it. So yes, we just want to create some, more awareness around this. So I'm going to hand it over to Jess to start going over some statistics about breast cancer.
There we go. So diving deep into the statistics actually it's quite frightening, even as a woman, kind of looking into this. So we went to the Cancer Australia website and got all these facts and figures.
Yep.
And it does state that 13% of the general population will develop breast cancer within their lifetime. So very scary, 13%. And obviously there's an increased risk with things like oral contraception, lifestyle factors, and then obviously the BRCA1 and 2 mutation, which we'll go into a little bit later as well. But just this year in 2022, there's been 20,640 cases of breast cancer, and that's just within Australia. So that's a huge amount of cases. And then 212 of those are males, which a lot of people still don't realise that males can still be affected by breast cancer. It is a very small percentage, but absolutely there. And then 20,428 are female. Quite scary statistics. We do say, if you're listening to this right now, while you're on your phone, go into your notes in your phone and put reminders in for the first of the month every month and just be like, check your breasts. So it's an alert and it will remind you. And in our show notes as well, we've actually got education on how to check your breasts. And it's always recommended in the shower with your hand above your head. But yeah, have a look at the show notes for that. I'm going to hand it over to Zana just to talk about the BRCA1 and 2 gene.
So there's obviously a lot of ways and reasons people develop breast cancer, but the most significant would be that someone has a mutated BRCA1 or BRCA2 gene. So these are two different types of genes that we found out actually typically stop you from getting cancer. So a mutation within them, damages that gene to make you more likely to develop breast cancer. And it also is linked to, other female cancers as well, other women cancers, such as ovarian cancer and things like that as well. So people who have the BRCA1 gene or BRCA2 gene typically have a higher risk. So if you have a parent that has a BRCA1 or BRCA2 gene, you have a 50% chance of actually carrying that yourself. And within that, 13% of the general population, like we said before, has breast cancer, has experienced breast cancer or will experience breast cancer in the future. If you do have the BRCA1 or BRCA2 gene, that increases your risk significantly. So having the BRCA1 gene increases your risk by 55 to 72% and BRCA2 by 45 to 69%. So that is a significant increase.
Yeah.
And knowing that you have these mutations early can be a great prevention and a great reduction in your risk of how to manage those, those increased risks. So testing for these genes is not recommended for the general public, as you can't just go and get tested for BRCA1 or BRCA2 unless you have some sort of genetic link. So speak to your family members, speak to someone who might know, if your mum had it or your dad had it, and see if anyone in your family history has had any breast cancer, because that's what's going to be your link to getting tested. And for those who, can't get tested, it's even more important that we make sure we're checking our breasts every single month. So someone who does have BRCA1 or BRCA2 gene, what this means for them is that they are going to be needing to have extra screening. They're going to need to have potentially in the future some risk-reducing surgery if they're wanting to reduce those numbers and reduce their risk of developing breast cancer. And that can come in different forms. That can come in the form of a double mastectomy directly for breast cancer. However, this also does, like we said before, also affect other female cancers. So this could potentially progress to oophorectomies or hysterectomies in the future. But we know that being females, there are other obviously biological clocks and things that women need to use their ovaries and need to use, their uterus to have children. So it's not necessarily something that you can just find out and do straight away. So it is a bit of a process. And Ruth does talk about how she found out at 19 and her discussion with her surgeons and her specialists about when these, surgeries would be realistic for her. So it is obviously tailored to each person. It's not the same for every person, but these risks do increase when you have these BRCA1 and BRCA2 genes, and we want to create awareness around that and make sure that people are aware of potentially things that are happening in their family history, or if not, at least they're checking their breasts and making sure that, you're putting your health first. It's something simple we can do every month to make sure that we can reduce these numbers, because it's pretty scary. And out of the population, 1 in 400 have the BRCA1 or BRCA2 gene. So it is a significant amount of us. We probably all know at least one, if not two people that would have, that gene. Some of them might know about it and some of them might not. So look into it if you, if you are interested in that. Otherwise, stay tuned for Ruth's explanation and her story. It's such a powerful story, and we really, really thank Ruth for sharing this with us, because it's very vulnerable. Something very scary to talk about, but we need to be talking about it, and we need to be creating awareness and making sure that we can eliminate breast cancer forever, because we do not want this to affect anyone that we know or anyone that we love. Right, so we hope you enjoy. Welcome, Ruth.
She's got a frog in her throat.
We'll give you a couple seconds.
Oh, just nerves. Hi, girls. I'm Ruth. Hey. I was diagnosed with the BRCA1 gene at 19. The reason we sort of found out was my dad's side of the family was being investigated by the Cancer Council of New South Wales, I think. And they found that in his paternal side, all of the women on that side had had breast cancer or had died of breast cancer. So they were looking at the genes that they had in common, and they found BRCA1. So they sort of went down the line to the living relatives, found my dad. Dad and his sisters got tested. Luckily, his two sisters don't have the gene. Dad did, so then it came down to us. My sister and I got tested at the same time. She didn't have the gene. I do. And then my brother has recently been tested as well, and he doesn't have the gene, which is great. Only problem is I do. One of the things that I just need to be more vigilant with is checking my boobs. I also go the next step further and have contacted a surgeon. Her name's Dr. Melissa Bochner. We're going through not going through the motions, but starting the processes of preparing me for a double mastectomy and reconstruction, so preventative. And every year I get a MRI. Breast MRIs are not fun.
No.
Any MRI is not fun, but a breast MRI, you have to lie down like Superman and have that, the dye put into your arm and all that.
That's, wow.
God, how long does that take, the whole MRI process?
It's probably about 20-ish minutes.
Oh, in Superman pose.
Yeah, so you lie down on your face, so you're sort of not watching anything, but you've got this chest plate that sort of sits in the middle of your boobs, and then your boobs go into these little cup things so they can get all of the tissue in there.
Wow.
It's very weird.
Yeah, so what age did you have to start getting the MRIs?
I only started 2 years ago.
Yeah.
So when I was initially diagnosed, I was told by the genetic counsellors that I didn't need to worry about anything until I was 25. So I was like, sick, let's not bother about anything. Went and lived my life, got my physio degree, was working in the country, and just sort of went, I don't really like not doing anything. I could probably be a bit more proactive because that's kind of me as a person. Yeah. So I contacted the genetic counsellors, and they said, oh, yeah, that's good that you want to do something, but you don't actually have to do anything until you turn 30.
Wow.
And that didn't fit very well with me at all. So I was
so from 25 to 30.
Yeah.
Yeah. I'm like, no, I need to go and see my GP, and got a couple of recommendations on breast surgeons. Spoke to one who said, get your boobs off right now. No, not worth having the risk there. And I'm like, that's fair play. Went and saw another one who said, I don't want to do a preventative double mastectomy on someone your age without breast cancer being present. I was like, that is also fair enough. And then I went to see Dr. Bochner, who was very much straight down the line, and said, what do you want? And I went, oh, good. Someone's asking me what's going on. And I decided that I want to get the double mastectomy and reconstruction, not right now, but in a couple of years' time, and do the preventative action in the meantime. She did also tell me that there's a few things that we can do to decrease my risk, which would be healthy lifestyle, decreased drinking, no smoking, recreational drugs, all that sort of healthy stuff.
Yeah.
I'm not much of a sit around and do nothing, hence you can see the muscles.
Love it.
I do love going to the gym. I used to be a gymnast, so I do love doing everything. And then, I don't smoke, and I've tried to cut down on my drinking, but wine is very, very nice.
Yes. Cool. As nurses, we understand
we
that.
like some wine. So can we just go back to when you were 19? When you're getting contacted, is this via email, a phone call, or is it just from when your dad told you? Like, how do you actually get contacted?
So Dad was contacted by the Cancer Council, and then he and Mum discussed whether they were going to tell us at all. They obviously did, because it affected us and our healthcare and that sort of thing.
Yeah.
So Dad sat us down at the table and sort of told us about everything, and said that we can go and get this done if we wanted to. And both my sister and I went, well, duh, of course we're going to do it.
Yeah, definitely.
Why not know? And then, just from there we had to go and get 3 separate blood tests done from 3 separate locations. And then the genetic counsellors got us in and had us separately to tell us the news. And Helen was the good news, which was great. And then I remember when she told us, because I had a stuff up, one of the labs didn't get my name right, so they had to can you do it again? I'm like, fine.
So you had to do it 4 times?
Yeah, so 4 times. And when she found out the week before me, she's like, I don't have it. And I was like, oh, if Helen doesn't have it, I think because kind of like Yang, my sister, she's all like, we're polar opposites, but also get along really well.
Yeah.
As long as she's not stealing my clothes.
So how did that feel? And I guess when you got that news, obviously you had got your sister's news before, and you kind of had predicted, that yours might have been positive, but still hearing that news is still pretty tough. How did that feel to hear that news that you had the, positive mutation?
At the time when I was sitting in the office, I tried to do the old, I'm cool and calm, collected. This is not going to change me right now. This is just something that I'm going to have to deal with. This is just going through the motions. Sort of understood. The genetic counsellor was looking at me like, here are the tissues. Are you okay? I'm like, yeah. All right, I'm processing, got into the lift with my then partner. And he's like, are you all right? And I was just full tears.
Not all right.
Everything just sort of went. I think I'm not very good at compartmentalizing emotions and sort of going through that way. I need to have like a real big reaction and then I can go.
Yeah.
So tears is kind of how I do it.
Yeah. And when they told you that news, did they tell you the news and then what kind of your future might look like, or did they just give you the news and you left?
They gave me how it could look. They kept going on about that because I've got this mutation doesn't mean that I'm going to develop cancer. It just is a higher risk. So just because I've got it doesn't mean I will get it.
Yeah.
But I'm like, that's cool. But then I looked at some of the stats and went, oh, those are high stats. I'd be happy with those on an exam result. That's not fun.
Yeah, exactly
we
right.
We looked at the statistics before recording this, and we'd done some in the introduction actually of this episode, and I was so shocked at the statistics.
Yeah.
So, heavy stuff to go through.
Yeah, and you hear all these stories. I'm on the Pink Hope Facebook page and you're just getting comments and posts every day. It's like, I'm this many weeks post double mastectomy, or I've just been diagnosed with this. And then you look at the ages of these women, and some of them are younger than me. And that's scary. Yeah, that is very scary.
Yeah, I think a lot of people don't realize, or don't really think about that it could affect people so young, especially just cancer in general. It's like, oh, you know, people die of cancer. You're old and you die of cancer. It's not something that you necessarily think, you know, in your 20s and early 30s that you'd even need to consider. But it obviously is such a huge thing for this, you know, age bracket, especially when it comes to breast cancer, which is why we wanted to do this episode. And it's also Breast Cancer Awareness Month, which we wanted to cover that as well, and just talk about how important awareness is, that people are aware of this and that these options are out there for them to explore if they have, you know, that genetic background, or even just, you know, chatting to your family members and having that conversation, being like, hey, do you know if like maybe had any cancer down the line, and having that open communication so that you can, I guess, be more prepared for these situations and prevent reduce your risk of having breast cancer in the future.
Yeah, exactly. And there's a few things that I didn't know about breast cancer, especially for BRCA1, is that it's a hormone-based cancer. So between the ages of 30 and 40, when you're in your childbearing years, your hormones do this more than they would normally. So it does increase your risk even further. And when I was 19, I was thinking, okay, this will be something I'm dealing with after I've had kids, because 19-year-old Ruth also thought she'd be married with kids by 25. A little bit slow on that one. But I didn't think that it was going to be boobs off, then kids.
Yeah.
But now I'm coming around to that of, I don't think I'm going to be able to breastfeed my own children, which is kind of scary.
Yeah.
So, yeah.
It is scary. I think it's obviously a lot of things to consider. It's a huge part of, you know, not just you as a person, but your, you know, feminine side and your, you know, that maternal kind of instinct that you have as well. So there's so many parts of you. It's like intertwined with like basically your being. So it's a huge thing, like, you know, removing something that's part of your being for you know, a reduction of something that could actually be quite traumatic down the line. So I can imagine there's a lot of things that you go through and you process in terms of how this is going to look for you in the future. So how kind of have you, I guess, processed that and kind of accepted the fact that this is something that is going to be your future? Yeah.
Yeah. Initially I wanted to find the partner and do everything together as like a unit, but haven't been that lucky yet to find someone that I want to go through it with. So I've gone from, I'm going to tackle this as a unit, to I'm going to do whatever I want. If someone's going to come along and be part of my life, this is also going to be part of theirs.
Yes.
So I'm pretty upfront about it with people, like dating people and things like that now. Initially it was, I don't want anyone to know about this.
Yeah.
Now, bugger it, I'm a private practice physio, and whenever we're talking about any sort of pelvic floor health, I immediately go, had any problems with your boobs lately? And I usually get a lot of, what?
Like, I'm here for a pelvic exam. What are you talking about?
It's like your back pain's all right, but your pelvic floor and your boobs, how you going?
Yeah.
And they always get the old, why did you ask that question? I was like, oh, well, I'm BRCA1 positive. I often find that those two areas aren't discussed very much in the scope of private health, but so just healthcare in general, unless it affects you directly. So I try and push it on them just to make them think about it. And then I often get a few women come back going, oh, yeah, well, I did this. And I was like, yeah, just go and see your GP about that. Like, I know you're perimenopause and that sort of thing. Just go and get it checked. Worst case scenario, the GP goes, no, nothing's there. I'd rather that result and have my patient come back to me and say everything's fine than, oh, actually, no, they did find something and I have to go and, like, the journey goes from, I've come to see this person's come to see me with back pain, and now I'm seeing them for the next however many months going through everything that they're going through.
Yeah.
I recently lost a patient who I was seeing privately. She died of recurrence of breast cancer in her brain, liver, lungs, and bones.
Wow.
Yeah, I saw her. When did I see her? I think it was 6 months post her mastectomy and finishing of her radio and chemo and that. And I checked out her scars and everything, and we were discussing surgeons, and I was like, oh, I'll go and talk to your surgeon. And I did eventually see him, which was nice, but I complimented him on his beautiful scar. The scar was absolutely very, very nice. I was very for her. And then you're going through, I think it was the space of a year, she was re-diagnosed and declined and declined and declined. And I saw her Friday a month ago, and she passed away on the Sunday night.
Wow.
Oh, wow.
And that was not a good Monday.
Very confronting to go through as well.
This is a bit too real.
Yeah.
And yeah, she was one of my patients that I would discuss most things with because she'd been through it. And I think that being able to discuss that with a lot of people brings people together and has that ability to sort of not dump everything, but knowing that you can go to someone and say, I'm just having a really crap day. This is bothering me. This is bothering me. This is hanging over my head. And to know that they're like, oh, yeah, I know that feeling. I know exactly what that feeling is. Do you want to do X, Y, and Z?
Yeah.
Rather than having someone go, how would you like me to support you? Again, great thing for them to ask how that I would like to be supported. But sometimes it is nice for just someone to go, let's do this. I'll take it away from you. Let's go and distract you and do something like this.
Yeah. Wow.
Very heavy. Thank you for sharing that with us. Well, obviously you've made the decision to do this double mastectomy in a couple of years. Is that kind of the end of this journey, or is there some further things that you have to do kind of in the future after this double mastectomy?
So after the double mastectomy and reconstruction, which I've just been told I can get nipple sparing double mastectomy.
Perfect. So you get to keep your nipples?
Yeah, very happy about that one.
That is awesome.
I also have to continue getting pap smears and everything like that because BRCA1 also increases your risk of ovarian-like cancer.
Yeah.
There's been, I think it was my great auntie who passed away of ovarian cancer. So it's, although breast cancer is a little bit easier to detect, ovarian-like cancer is the next one that I'll be tackling as such.
Yeah.
So, yeah.
So just more screening? You just have to do more screening. Is there any other surgeries that you have to do in the future in terms of like tubes or anything like that? Or
I can choose to go and get a full hysterectomy. So an oophorectomy would be the minimum.
Yeah.
But then after that, if I could get a full hysterectomy, I have discussed with my dad, his cousin's daughter found at 35 she had the gene and then found out she had breast cancer, and she decided to get the full double mastectomy and then the oophorectomy or a hysterectomy. They were very close together. I think it was in the space of a year. It was like lots of months.
Wow.
I think she was 35, I remember Dad saying. But she'd had all of her kids.
Yeah.
So I haven't really looked into that yet because I'm thinking, well, I still need to use them.
It's a lot of pressure, I think, even just as a woman in general, when you're thinking about kids and, social pressures and aging eggs, and there's all these things that we already have to deal with as a woman, and then you've also got this added stress of the BRCA1 gene that you're kind of adding into it. But I think you're doing an absolutely amazing job, and especially the education part of it, like educating people around you, clients at work, like that's an incredible thing, and we thank you so much for that.
That's all right. Thanks for having me on. I love talking about myself, so this is...
I love that. What advice would you give to people, I guess, maybe starting this journey of, finding out if they have a positive mutation, or even after they've found out that they've had this positive mutation? What is your advice for these people?
I get yourself a really good GP and a really good specialist. Your support networks around you are going to be what saves you. So if you're concerned about anything, your GP is your first point of call, and then from there your specialist will be after that. Getting your checks done every year or every 6 months, depending on what your specialist recommends. And then just being really open and honest with your nearest and dearest as to what you're going through and how things are sort of tracking in your head. I actually found a lump a month ago in the left axilla, and it was there, but it was not there. It was there, it was not there. So I went to my GP this morning and she went, let's go get an ultrasound. I'm like, good, thank you. Yeah. So that I didn't discuss that with my parents before going to the GP, and now this is what's happening, guys. I'm going to go on this date. This is what's happening from there. So they're all aware of what's going on. It's hard to tell the people that you love that you're worried about yourself.
Yeah.
Anyone in healthcare knows that you put other people before yourself, and it's not until you physically have to stop and go, oh, I should probably check that out, or I should probably do something about this before anything gets done. So preparation is better than anything.
Definitely. Yeah, and awareness and education, which is what you're doing and what we're trying to do with, Breast Cancer Awareness Month and with this podcast, just so people are aware, because awareness is, the best prevention, really.
Yeah, exactly.
Yeah. Oh, well, thank you so much.
That was so much fun.
Yeah, thank you so much for sharing that. That was honestly so great.
Cheers. Thanks, girls.